Here's something for those stressed and tensed shoulders. We call it palming the shoulders in the work that we do in Thai-inspired manual therapy, and I'll give you a tutorial through it right now.
The first thing to set up is some kind of support, so bringing in a bolster or a blanket and stepping in with a front foot and making some solid contact to give the low back some nice support. Then bring the heels of your hands right on top of the shoulders, in nice and close to the neck, and start with your fingertips facing forwards. Then with your arms straight and your back straight, start to gradually tip weight down into your person's shoulders. The idea with our pressure here is to gradually sink in and take up space. So we're not pressing into the muscles. Instead, we're thinking about using our body weight to settle down and take up the available space in the muscle. That means as you settle in, once you start to feel the muscles sort of pushing back and resisting your weight, that's where you pause and you keep that pressure applied. It's also the perfect moment to check in verbally and see if you've got the perfect amount of pressure, or if you could use a little bit more weight or a little bit less weight to get that ideal amount of sensation. Since this is the first touch for our palming of the shoulders, we're going to keep it a little bit shorter, so you can start to gradually release your weight and turn the fingertips from forward facing out to the sides now. You'll also notice that we're keeping the heels of the hands still in really close to the neck, so that you're not only getting the upper trapezius muscles, but you're also getting some of the fibers of a muscle that we call levator scapulae. Gradually start to reapply your weight, trying to find that ideal amount of resistance again that you found in the first contact. And then once you've found it, pause there. And this is where we test out your patience. We're going to take some really good time here with each of our compressions, because it oftentimes takes the body a few breaths to even start to settle in to receiving that kind of pressure. And after another breath or so, you can start to gradually release that weight and now turn the fingers down the back. So we're now taking our third hand placement. We started with the fingers forward, then we went to the fingers to the side, and now we're using the fingers facing down the back. Still trying to get the heel of our hand in really nice and close to the neck, right up on top of the upper trapezius. So the hand placement is similar each time, but given that we're turning the fingertips in different directions, the sensation of receiving this pressure is often quite significantly different between our different hand arrangements. Once again, we're going to try and find that ideal amount of pressure, and once you've found it, stay there. Pause for a little while, give your partner's body a little bit of an opportunity to settle in and perhaps make a little bit more space. Given that this area of the body for most of us carries a bit of extra tension, it can really take some solid time to find that sensation of release. As we start to finish up the first round here of compressions, you might feel that your front leg or the hip of your front leg is starting to get a little bit uncomfortable. So in between rounds, you might decide to change your front leg, re-establish the support in the lumbar region, and set yourself up for round 2, starting with the fingertips facing forward once again. Now that it's our second round here, you might find a couple of things different from the first round. One is the temperature of the skin underneath your hands might have increased, and that's a result of the first round of compressions that you've done, increasing the blood flow to the area, which is something that we're looking to provide. And number 2 is you might find that the tissue is giving you a little bit more space, so please feel free to take up that space as long as that's good for the person that you're working on. You can then head to your second hand placement with your fingertips facing out to the sides. I personally like to think of the first round that we've already done as being the round of calibration, where you get a sense of how much pressure the tissue can handle, and the person receiving also gets a sense of how much sensation they can manage and still breathe comfortably into the work. The second round I would consider to be the round where we start to get the release, and then the third round is where the majority of the release happens. When you're ready to, you can turn your fingers now to face the back for our third hand position, the last hand position of our second round, and settle in once again, seeing if you can take up a little bit more space, if the muscles have a little bit more space to give you as you apply your body weight. Almost all of us could use some really solid time here in these compressions in palming the shoulders, but it's especially good for people who spend time at a desk and type a lot, and also for those of us who get tension headaches. If you get tension headaches, I would recommend spending a good amount of time here in palming the shoulders and also making it a regular thing. I would also couple this type of release work with more active work afterwards to get the muscles of the shoulder girdle and the upper back moving in various different directions and at various different lengths, but we'll save that conversation for another day. For now, you can start to release that application of pressure and finish up your second round of those 3 hand placements. A little sweep here can also be a nice way to just give the tissue a bit of a moment, a little bit of a rest before you repeat.
Normally I would do at least 3 rounds of palming the shoulders. For the sake of the video, I'll just keep it to 2, but please continue to practice at home. Make sure also when you're done, you switch so that you not only get to give this type of technique, but also you get to receive it. Please hit the subscribe button if you'd like to see more of these, and comment below how you feel after it.